Integumentary Infective Disorders lecture. So in this lecture, we will be talking about the major skin disorders that are caused by infective microorganisms. Infectious diseases of the integumentary system can be caused by viral, bacterial, fungal, and parasitic infections. First, we will talk about the viral infections. Herpes is considered a viral infection, and there are 4 main types of herpes. However, there are some other types of herpes that are less common. The first type we will talk about is herpes simplex 1, or HSV1, which is also called cold sores. Herpes simplex 2, or HSV2. Herpes varicella, which is oftentimes called chickenpox, and herpes zoster, which is also called shingles. All 4 of these are caused by the herpes virus. In order to determine whether it's herpes simplex 1 or herpes simplex 2, we follow a common rule. Herpes simplex 1 is above the waistline. Herpes simplex 2 is below the waistline. Generally, these are STDs. Below are some pictures of a cold sore or herpes simplex virus 1 on the left, and on the right we have what is called shingles. Shingles is caused by the varicella virus or the herpes virus after a patient has become infected with the herpes varicella virus as a child. It then lays dormant in the nervous system. Occasionally in life, it can reoccur or exacerbate and cause the herpes zoster, which is called shingles. Shingles appears in painful vesicles, as you can see here, and occurs in a band-like pattern along the peripheral nerve that is affected. Usually these infections are on one side of the body. And usually herpes zoster is exacerbated with stress. So symptoms of herpes are fluid-filled vesicles, which can be painful, especially if it's herpes zoster. The diagnosis is observation, positive viral culture, blood testing for the herpes antivirus, or antibodies, I should say. The treatment is valcyclovir, acyclovir, or famciclovir, which helps minimize the symptoms, but it does not cure the disease. So herpes oftentimes will go into remission in periods of exacerbation. So sometimes you will see it and sometimes you won't. Prevention is vaccination for the chickenpox, which can be done in children and usually consists of multiple inoculations to build immunity. And then there is also a shingles vaccine for older adults. And then to avoid skin-to-skin contact with those who are infected, especially for those who are infected with cold sores or STDs. Furuncle, also called warts, is another viral infection. Common warts usually are pretty painless. They are predominantly in children. These lesions are contagious and are spread by scratching of the surface and then direct contact. Plantar's warts typically are of the foot and sometimes can be painful when walking. They appear on the sole of the foot or toes, and they have the appearance of cauliflower, and they will sometimes have black pinpoint dots in the center of the cauliflower shape. And then genital warts are sexually transmitted diseases and are also highly contagious. Verrucau, the etiology for Verrucau are caused by the papilloma virus affecting the keratin cells of the skin, causing hypertrophy. Some symptoms are rough surfaced skin lesions. Sometimes black pin needle dots can be seen throughout. And the treatment is salicylic acid, and a lot of these can be over-the-counter treatments, liquid nitrogen, which is done in the doctor's office, or laser surgery. Once common warts or plantar's warts are treated successfully, the body recognizes the virus as an invader, and reinfection is really uncommon with the common warts and the plantar's warts. Basically, they spread because the body does not see this virus as an invader. Impetigo is a bacterial type infection. It is mainly due to poor hygiene and malnutrition. The etiology is Streptococcus and Staphylococcus bacteria. The symptoms are vesicles or pustules that rupture, producing a yellow crust over them. We diagnose this by bacterial culture by swabbing the ruptured pustules or vesicles. Treatment, washing the area, applying antibiotic ointment, and sometimes oral antibiotics are needed in order to treat this condition. Prevention, we typically prevent this by good personal hygiene. Folliculitis, which is an inflammation of the hair follicle. The etiology starts when the hair follicles are damaged by shaving or by friction, and the damaged hair follicle then becomes infected with staph bacteria. Symptoms are rash, itching, and formation of pimples or small pustules in the area. Diagnosis, we just observe this. And treatment are warm, moist compress, daily cleansing with an antiseptic, and application of antibiotic ointments for several weeks may be needed. Abscesses, furuncles, and carbuncles are sometimes present in skin disorders. Abscesses are a localized collection of pus. Furuncles are also called boils, are small abscesses of the skin and occur around the hair follicle. Some common sites are the neck, back, and buttocks. Carbuncles are large abscesses that involve several intercorrected furuncles, and they typically arise in clusters with multiple drainage sites. The etiology of these are caused by pyogenic normal flora bacteria, Staphylococcus. Some predisposing factors for this are people with low immunity. Symptoms include inflammation, infection, and formation of a capsule to wall off and prevent the spread of infection. Sometimes they can be painful and usually do come to a head eventually. Diagnosis is mainly observation only. Treatment, warm, moist compresses, surgical opening and drainage of the abscess might be needed, and antibiotics if there is a bacterial infection involved. Cellulitis commonly appears in the leg but can affect other parts of the body. The etiology is a bacteria infection commonly caused by strep or staph. Its symptoms are pain, redness, swelling, warmth, and tenderness of the involved skin. Sometimes patients will have a headache, fever, or chills. And usually in advanced stages you will see red streaking of the skin. So as you see here in the picture, you'll have a red area, very cognizant of cellulitis, but then in advanced stages you will start to see streaking up or maybe down the leg, which is is usually an indicator of patients becoming septic from this infection. Diagnosis is examination. Sometimes we'll do an ultrasound to rule out deep vein thrombosis or DVT. Treatments are oral antibiotics and analgesics for pain. And mainly we give analgesics because sometimes with the infection, the skin can become very tight, compressing the nerves, causing some pain. Lyme's disease. The etiology is caused by the Borrelia and is transmitted to humans by deer or black-legged ticks. Symptoms are flu-like, arthritis, malaise, chills, and fever. You will sometimes see a bullseye skin rash, as seen in the picture on the right. However, this rash usually appears days or weeks after the initial bite. So if a patient calls and says, I got bit by a tick today and there's a bullseye rash, typically that does not happen. Diagnosis. We diagnose it by confirming the tick bite, and then we also do blood testing to confirm antibodies in the blood. Treatment is antibiotics for several weeks, and the prevention is for patients to wear insect repellent, wear long sleeves, and inspect the skin when in high-risk areas. MRSA, an abbreviation for methicillin-resistant Staphylococcus aureus. The etiology is it's a strain of bacteria resistant to antibiotics used to treat, and is due to the overuse of antibiotics in humans and antibiotics in our food sources. Typically, Staphylococcus is present on our skin and is part of our normal flora. We get MRSA when we develop the resistance from the antibiotics. The symptoms are small red bumps that resemble pimples or boils that become abscesses, and sometimes can be septic infections causing fevers, chills, shortness of breath, and malaise. Diagnosis is culture and sensitivity of a nasal swab. And treatment of MRSA is typically vancomycin IV. Tinea, also called ringworms, is a fungal infection. So we're moving on to fungal infections of the skin. And they like to affect warm, moist areas and feed on perspiration and dead skin. So there are several different types of tinea type infections. There's tinea corpus, which are ringworms, and these are round, red lesions on the arms, legs, or back, typically. Tinea pedis is athlete's foot, which causes itching and burning of the foot. Tinea curris, which is also called jock itch, is itching and burning in the groin area. Tinea ugarium is fingernails and toenails infection. Tinea capitis is it infects the scalp, causing areas of hair loss. And then tinea barbae, which is barber's itch, which affects usually the bearded area of a patient. So tinea, the etiology is a variety of fungi. Symptoms are itching, burning, cracking, and weeping of the skin. It is kind of dependent on which type you have. Diagnosis is basically by appearance, and then sometimes we will do skin scrapings. and send them to the lab for testing. Treatment: keep the area dry and clean. Oral antifungal medications such as ketoconazole and fluconazole can sometimes be given to get rid of the fungal infections. Candidiasis is commonly called yeast infections or thrush. Those are the two most common types. The etiology is the overgrowth of Candidia fungi. Is usually a result of taking antibiotics and affects those sometimes with diabetes. Symptoms: thrush, you will see white patches in the mouth, as you can see here on the right hand side. Diaper rash usually is red inflamed rash, and then nails in the genital area will have an itchiness to them. Topical treatments are typically the treatment of choice, and it really depends on what you have going on, but they can also do oral medications too. You can do monostat, fluconazole, clotrimazole are all topical creams or oral medications that can be given for candidiasis infections. Pediculosis, also called an infestation of lice. There are three different types. There's head, body, and pubic lice. The etiology is the spread from direct contact with an infected person. Symptoms can be seen in various areas in the body depending on the type, but can cause itching. And the diagnosis is observation. Typically, most states in the United States mandate that schools screen for head lice. Treatments are RID or NICS are the most common treatments. Also, it is important to educate patients to wash all linens and clothing in hot water, and then also treat and clean furniture. Scabies is an infestation of the itch mite. The etiology is the pregnant mite burrows under the skin and lays eggs near the surface of the skin. The eggs hatch in 3 to 4 days and mature on the surface of the skin in 2 to 3 weeks. Then they mate and the cycle starts all over again. They are transmitted by skin-to-skin contact for an extended period of time. So if you have brief contact with somebody, likelihood of you getting scabies from them is very small. Scabies cannot be transmitted to humans from animals. Animals are infected with a different type of mite, so it can only come from human to human contact. Some of the symptoms of scabies is intense itching, tends to get worse at night. There will be vesicles or pustules that will sometimes scab over. The diagnosis is microscopic skin examination, and the treatment is lindane cream applied for 8 to 14 hours before showering. Typically, you will apply this before the patient goes to bed, and then they take a shower the next morning. Itching may persist for 3 to 4 weeks after the treatment. So it's important to educate patients on that piece, and clean and treat all personal items with hot water, which is similar to the infestation of lice.